Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Miles Conrad and Anthony Nguyen about the importance of coaching for medical students. Dr. Conrad is a clinical professor of radiology at the University of California, San Francisco, and is coaching Anthony, who is a third-year medical student at UCSF. Thank you both for joining me today.
Thanks for having us.
Dr. Conrad, I'm going to ask the first question of you. What is the role of a coach for medical students?
Well, the role of coaching and mentoring are kind of used interchangeably in some situations, and in medical education and business. But here at UCSF, the role of coaching is an umbrella term. Coaching is an umbrella term that encompasses mentor, professional and personal advocate, teacher, and all those things together. And we are people that are paid by the university to teach. So, one of the challenges with educators at a university like ours is that if you have volunteer faculty, the consistency and it is kind of hard to maintain. And so basically part of my salary is paid, 0.2 FTE is paid out of the university. And so I'm trained as a educator in a kind of intensive format to get ready to teach and coach and advocate for young learners like Anthony. And it's just been an incredible experience. So overall, I would say I teach anatomy and physiology in small group sessions, professionalism, physical exam, H&P taking, and all things in between, including health systems improvement, which is a project that Anthony have done and I have done extensively for about a year. So all those things together are part of the education component, but I'm also here as an advocate for Anthony and to try to support him, because attending medical school, as I recall very well, was a traumatic experience sometimes for many people. It's overwhelming. There's issues of imposter syndrome and depression and big changes in someone's life. And so UCSF recognized that coaching could be a way to resolve and interrupt some of these problems that people have in early medical education. So that is kind of the role of coaching at UCSF.
So Anthony, what types of support has coaching offered you as you experience medical school?
Of course, Miles has touched upon many of them already. And really, coaches like Miles have helped me navigate the rigorous academic demands, the humanistic morality and compassionate care experiences that make up medical school. It is a long and difficult journey with many branch points of paths to take, but Miles has really been my mentor and guide, nudging me along the way towards better and better pursuits, giving me guidance to overcome obstacles and reinforcing my skill sets every step of the way. He's helped me, and especially in acclimating to medical school and the preclinical environment when I first started. He's been a great clinical instructor, helping me not only know how to perform, but really understand each of the physical exam maneuvers and how they give me greater insight into a patient's condition to reach a diagnosis. It's beyond just medicine and go through the motions, but understanding how to be a detective and working with a patient to get a better and clearer image of the mystery at hand. He's been there when I really need him, when I faced patient care experiences that have been both beautiful and arduous. He's helped me navigate the stresses and taxing emotional impacts of taking care of critically ill patients in the time of a global pandemic. And he's really helped me see the light and have a reminder of why I pursued medicine. In total, Miles has been a coach to support me in a multitude of ways to help me grow as both a physician and as an individual.
Well, I just want to say thanks for saying such nice things about me. I think I had to chuckle a little bit because it is funny to think of a radiologist teaching, physical exam and a lot of these things, but we are pretty good at anatomy, and we do have to work with people all day long. So we are, we're affable people overall. But it has been a challenge, I think, having to relearn the physical exam was something that I didn't expect, because I don't do a lot of that as a radiologist, although I'm an interventional radiologist. So I take care of patients and do H&Ps and things like that. But yeah, I mean, it was an intensive training program, to get ready to teach people like Anthony. Anthony comes with an incredible work ethic. And so if you want to teach people that are smart and are really well prepared, then you need to prepare yourself. And I've learned over the course of my time as a coach to basically, you have to earn trust every day. Every time I teach, I have to prepare. I have to get myself in the zone, because we have 6 students in our small group, and I coach 6 students every time in our small groups, and they bring their A game all the time. So it's been a challenge for me, but it's been rewarding, because I get to see the progress and basically be involved in early medical education, which there's nothing like that. So
A lot of it is understanding Miles as a role model. And it's the fact that although he says he's been not doing these physical exam maneuvers for a while, it's really the care that he puts into each interaction with every one of us. There's 6 medical students, but he treats every single person in each small group with the proper attention and the proper unique approaches to help a student really understand what needs to be understood and help them learn in various different modalities, whether they be a visual, audio learner, or to take a step back sometimes and understand, wait, is there something else going on here? I noticed that something's off right now. Do you want to talk about it in private? And helping the factor through all of the underlying aspects to really be able to have the mental capacity and physical health, and to understand, wow, I can be a student. I can take this stuff away, and I have a wonderful role model here to help me understand what are components of the type of physician I want to become.
Well, I was just thinking when you were saying that well-being is such a huge component now of radiology departments around the United States and in medical education. And so, Anthony, do you think what kind of impact do you think coaching has had on well-being? And before you answer that, I'll say that I think that, well-being is a critical component, because basically the learner becomes distracted, sometimes distraught over certain issues. There are so many factors that go in, and it just takes a community and really a village to support people through medical education. It is an overwhelming experience, and I have a lot of empathy for Anthony, because I went through it myself.
Yeah, I agree with that. And there's multiple aspects of well-being. First and foremost, what comes to mind in a global pandemic is burnout. And it is so easy to see that. It is so easy to have every single patient on your list be critically ill with numerous problems. It is hard to take care of so many people when your fellow staff may not be able to come into work because they may have gotten COVID as well. If we're only putting further stresses on everyone's workbook. And it is hard to have so much to learn every single day and pack in more and more and more. And for myself, even when I was going through my first 2 years, I had a lot of burnout. And it's hard to feel really secluded in a room where my heads are in my textbooks or my head's in my laptop, learning something new every single day, and feeling a pressure to understand this. It's like, I know I'm going to be able to use this someday, and I hope to be able to use this to help better a patient's life. And sometimes it's nice just to get a random phone call by Miles here and there, saying like, hey, but I just want to check and see how you're doing. And then afterwards, just having somebody reach out as a coach in that regard. And it's like all the pressure is being built up to finally have an avenue to just let it slide out and have somebody to talk to who knows what it's like. And I think that's the big, big difference. The camaraderie and the support within the medical system. As of course, I can always be frustrated, and I know my family will always be there for me, but to really understand the exact same experiences, one has to go through it themselves. But it's wonderful to have somebody who's known these obstacles, being able to give their advice in how they have overcome it. And also giving other things of like, hey, are you still working out? Are you still having a little bit of time to like just take a breather? It's a beautiful day outside. How about you stay outside today instead? And just having these small things, it helps me reinforce my own well-being to be able to, again, be a great learner and to be also maximize my time and prevent further burnout.
Well, I think you raised a good point, and that was that. So Dean Lucy here at UCSF, who is the one of the deans, came up with this idea of coaching in the School of Medicine, and it was her innovation, and it was born out of this idea that medical students go through medical school. I did as well, basically kind of anonymously. I mean, people don't really, your educators don't really know you on a personal level. And you just kind of, you go through as a learner, known just in a professional sense, only in your interactions on the wards or in class and stuff. And maybe that's not enough. I think, maybe we need to have people that kind of know people better, that so they can kind of curtail their support for those students on an individual level, and de-anonymatize students and really personalize them.
Is there a right time for coaching to start in medical school?
Day one of medical school is, one of is when coaching starts. So we start with diversity matter orientation, and then go right from there. So basically, I think I was one of the first people from the School of Medicine that Anthony met, maybe, and maybe at least the first person in a small group. So yeah, I think the big traumas that we talked about, the big challenges start on day one. When you start feeling, oh no, I don't know if I'm supposed to be here. I feel inadequate. I'm scared. I've moved to a new city. I haven't finished what I was, involved in the summer. I'm not ready and things like that. So we need to be involved in day one. And that was part of the curriculum.
It sounds like you both get and give as much as the other. I mean, would you agree with that you're both getting support from each other in this relationship?
Go ahead.
I do agree quite a bit. And I think it is so important to have this because one of the things Mal has taught me is to be a great physician in the future is to have a love for lifelong learning. And who you learn from are not only people who are older than you. To understand that you can learn from your patients, to learn from your peers, fellow attendings, and also to learn from your colleagues, whether they be both older or younger. In teaching, there's a lot of learning, but also for the student to reach out further as well. And that is something that I feel Miles has really ingrained upon me that I hope to take on for the rest of my career. And in doing so, like this type of relationship and coaching that's really been meaningful to me. Miles has said that since day one, like we've met, and really I look back upon that fondly. My white coat ceremony was postponed in the times of COVID. This was in the peak times before a vaccine came out. And thus we couldn't have in-person large group gatherings. it's not okay. But I had such a great relationship over time in our small group that Miles made a very small ceremony at the top of the Zuckerberg San Francisco General. It was socially distanced just within the teacher and student. And he was the one who donned my white coat and went through the whole ceremony. And these are why it's so important to have these things, because these memories cultivate a lot of impacts for how coaching has supported my training. He has been not only my mentor, confidant, and friend, but he's been a quintessential role model for me as both a physician and a teacher. And through his actions and his words, I've picked up how spending greater care can really positively impact my patients' lives during the hospital visit and also when they leave the hospital. And in cultivating my own identity, I really hope to emulate such empathy and compassion in this mutually shared humanistic and goal-directed care throughout my career. Because what I've taken away from this coaching is that we learn how to become better doctors through experience, reflection, and guidance. And I want to be able to pay it forward in this cycle of mentorship and teaching. As how Miles has coached me, I'm inspired to coach others and to teach others as I progress through my career, and even preclinical topics like anatomy and physiology. And I still even do this today by helping teach first-year medical students. And I really believe that what we brought up, this learning from one another, is a cycle of positivity and growth in coaching.
Well, you're certainly an easy person to teach. I can tell you that. And, you know, he always comes prepared, and he's super professional. And I think what I've always been impressed by you is your deep commitment to constantly trying to improve yourself to become a better and better physician. And he seems to do that on a daily basis, you know, with reflection and a lot of introspection. And that's an incredible asset that Anthony has. So, I mean, he's going to be a superstar in medicine, in the world of medicine. But yeah, I mean, going back to, you know, what do I get out of it? Well, I think that, you know, I'm a mid-career attending physician, and I've always been interested in medical education. And, you know, I go through burnout too. I mean, I've been exhausted. I mean, I take a lot of call. I have research obligations and clinical obligations. And, you know, I get injured over time too. I get, you know, sad about complications and challenging cases. And I've suffered, you know, a lot during my career as a proceduralist. You know, harming people has been one of the big challenges of my life, to try to get over that and try to move on and still take care of patients. And addressing these issues with learners, I mean, these are the issues we talk about, you know, rejuvenation and mental health in physicians and medical students, and professionalism, and how to talk to patients, and how to address equity in hospitals and things like that. So all these things have been critical for me to learn from Anthony and our 5 other students in our core group, and also the other faculty that, you know, I'm part of. So I'm part of a group of coaches. The entire School of Medicine is filled with coaches. So I can't remember how big your class is, Anthony, but we're divided into about 6 students per coach, and we all go through this together. And so there's a bunch of coaches, and it's a learning process for all of us. And it came just in the right time, because I was just burnt out. And now I get to teach people 1 day a week. And I think that's resulted in some rejuvenation for me. So I'd say this has been the greatest mid-career move, and brought back purpose to medical education for me. So that it's more than just giving a talk and talking to somebody during a procedure. But I think I'm just more involved now, and it's been really rewarding. I think I treat patients better now. I've learned how to communicate with people better. And I think some of the tips from a lot of my peer coaches have been really instrumental in that.
So definitely mutually beneficial.
Totally.
Well, thank you both for sharing a little bit about your coaching relationship today.
Thank you.
Thank you so
Thank
much
you,
for having
Jennifer.
us.
For more RSNA news, visit rsna.org/news.